So this here is Susie. She helps me teach kids. I have George too. George has an extra tooth that Susie doesn't have, which is a canine. That's why I was asking those kids, is it a girl or a boy? Does it have a canine or it doesn't? So right here in the bars, you saw that tooth on the other horses. That's how you know it was a boy horse.
Oh.
Now, female horses do get those canines, but they're super tiny. If they do, sometimes they don't. If they have them, they just have more testosterone than a normal mare, because that is a male thing.
Okay.
They use canines to fight with. They come in at 4, 4.5. So if they said, hey, this horse is 8, and you could feel those canines coming in, but they're not quite there, you're like, you're lying, it's 4. So teeth will tell you, young, middle, age, and old. That's why I was trying to teach them. The young ones are very square and boxy because those are fresh new teeth. And then as they age, they get closer to the root, so they get skinnier.
Right.
So when they're middle age, they're very rectangular, boxy shaped.
Okay.
And then when they're old, they're very rectangular and skinny shaped.
Okay.
So that's how they were able to say, hey, he's young, he's middle age, he's old.
Okay. Got it.
And so then she doesn't have any extreme. So if you close your eyes and you kind of feel like there's a little hump, kind of, that's a step. One tooth is higher than the rest. So that's what I have to go in and file down. A horse will feel that little small step. And then 2, you feel this, how sharp it is. You have that pepper tone. I have a picture I'll show you. This horse is from that. So this is even worse. Their cheeks.
Oh, wow.
Yeah. They were overdue. It rips the cheeks bad. And so that I go in and fix that. So yeah, I'll go in with these guys and grind them down. She doesn't have extremely bad teeth, but sometimes they're bad.
Oh, yeah.
And it will take, especially rescue horses, it will take forever to grind it down. So then I have different tools for different parts of the mouth and different problems. And it's really important to get it really close to being precise, because you want that bite to line up pretty perfectly. You don't want any of that. It's supposed to be a straight line across. So that's what you have to do, is kind of set it back down. Now that's called actually balancing. Floating is where they hit the little hooks here and the points here, and that's it. They're floating. That actually set it back to natural. And same thing with the front teeth. A lot of vets won't touch this, like that she's smiling. So I would have to take just the middle part down here, and then on the lowers, I'd have to take the third incisors or the edges down to make it meet that flush, so that they can grind. Because they don't chomp chew like you do. You chew up and down. They don't do that. They go down, out, up, in, and it's just this continuously grinding motion. So when they're doing this, eventually they're shearing off these teeth, and that's why these guys get so sharp. The younger they are, the harder they're chewing, the faster they get sharp. Right. You also have, between birth and 5, all these baby teeth coming out, new teeth coming in. Sometimes they get in out of sync, and that's really what starts the problem, is those baby teeth not coming out on time, and the adult teeth can't come in on time, and then one overwears, and it's just a downhill spiral if you don't keep it in check. Okay, so once those baby teeth fall out, you want to get them reevaluated, make sure everything's in sync. If one's a little too high, you want to tap it down just a hair so it can get back in sync. So really, it's imperative, like, those first 5 years, just keep watching. Because if there is something slightly wrong, you can get it back on track and live to 30, 40 years old. It's just so rare, especially if you don't have the horse from birth. What if you get the horse at like 15? There's already a problem set, and now you're just doing preventative maintenance to try to keep them healthy.
Yeah.